Thank you for joining this Facebook Live discussion on behalf of the American Psychiatric Association and the American Lung Association. I'll now pass it over to Jennifer Falkenroth of the American Lung Association.
Thank you so much. And thank you to all who are joining us today for our Facebook discussion, the mental and physical harms of vaping. I'm Jennifer Falkenroth, the National Senior Director of Tobacco Programs with the American Lung Association. And joining me today, we have Dr. Albert Rizzo, pulmonologist and Chief Medical Officer with the American Lung Association. Hi, Dr. Rizzo.
Hello.
As well as Dr. Tahim Zaman, an addiction psychiatrist and associate professor of psychiatry for UCSF, and also serves on the American Psychiatric Association's presidential work group that is focused on vaping. Hi, Dr. Zaman.
Good morning. Thank you for having me.
Thank you so much for joining us. You know, with back to school being in full swing, the American Lung Association and the American Psychiatric Association are here today to really take a deeper dive into e-cigarettes and vaping and these tobacco products' impact on mental and physical health. But before we tap into our two experts here, to learn a little bit more about the mental and physical impacts of vaping. If it's okay, I'd like to go ahead and start with a little level setting on what e-cigarettes are and why this topic is so very important for today's discussion. The Surgeon General reports that e-cigarette use among youth is a significant public health concern, and steps must be taken by parents, educators, and especially policymakers to really discourage use of e-cigarettes. The American Lung Association is very concerned that we are at risk of losing another generation to tobacco-caused diseases as a result of e-cigarettes. So what are e-cigarettes? Electronic cigarettes or e-cigarettes include e-pens, e-hookahs, e-pipes, e-cigars, also collectively known as ENDS, electronic nicotine delivery systems. And according to the FDA, e-cigarettes are devices that really allow users to inhale an aerosol containing nicotine and other substances. Unlike traditional cigarettes, e-cigarettes are generally battery operated and use a heating element to heat the e-liquid from the cartridge, which many times may be refillable or disposable. And they release a chemical-filled aerosol that then is directly inhaled by the user as well as emitted out around the user for others to also breathe in. Now, there's a huge misconception, and we consistently hear, well, what's the big deal with e-cigarettes and vaping devices? Isn't it just water vapor? Absolutely not. And this is a myth that we are here to squash today. The main component of e-cigarettes is the e-liquid that is contained within the cartridge or the tank. And to create that e-liquid, nicotine is extracted from tobacco and mixed with a base, usually propylene glycol, and also may include flavorings, colorings, and other chemicals, such as formaldehyde and acrolein, which we know causes irreversible lung damage. So again, that nicotine is extracted from the tobacco plant for these products. Therefore, e-cigarettes are tobacco products. And so we really want to hit that head on today and learn a little bit more about the impact that they have. And we know that it's prevalent. I think we've all seen the shops popping up on every corner within our neighborhoods, selling these vaping products, and they just seem to keep multiplying. You know, how big is this thing? So the Surgeon General has declared e-cigarette use an epidemic here in the United States, with a staggering 20% or 5 million of all of our youth using these e-cigarette products. Now, this is a staggering increase considering 135% increase just in the last 2 years. So we know it is affecting our families. We know it is in our community. Let's learn a little bit more about what exactly it's doing to our mental well-being, our mental health, as well as our bodies, our physical health, and of course, our lung health. With that, I'd love to bring in our experts for today. It's okay, Dr. Zaman, I'm going to call on you first. I'd really love to dig into a little bit more of the mental impacts as it pertains to e-cigarette use and vaping. Could you talk a little bit about what you're seeing?
Absolutely, Jennifer. And I think as an addiction psychiatrist, one of the first things I think about and talk to folks about is actually the risk of addiction, right? So I think many folks can think, as you were saying, that vapor is something pretty safe and pretty innocuous compared to cigarette smoke, which we know is not safe at all and very addictive. But we know that actually the vaping, kind of the liquid that you mentioned, can contain really high concentrations of nicotine, sometimes much higher than cigarettes. So one kind of vape pod, for example, might have as much nicotine as an entire pack of cigarettes. So something I think about is just the addictive potential of that. For a lot of folks, it might actually lead to addiction to be using high concentrations of nicotine. And the higher the concentrations, the more regularly someone uses, the more likely they are to end up developing an addiction at some point in their life. So that's probably the first thing that comes to mind. And in my practice, I see a lot of folks who have other mental health conditions in addition to vaping or smoking. And that's something we always want to be really thoughtful about. There have been a couple of big studies now showing that in both adolescents and in adults, that there is an association between vaping and depressive symptoms. So we want to be thoughtful about that. Now, association does not kind of imply causation, so we don't know what's causing what. But we want to know about that. And if someone has concurrent depressive symptoms, we want to just educate them that, treating that appropriately might be helpful for them overall, but might also help them with their vaping and cutting back on that. In addition to that, particularly in adolescents, we're also seeing some association with symptoms of ADHD. So that's something that we think about and want to screen people for. And just overall, one thing we know about all addictions, including to nicotine products, is that treating a mental health issue that someone might have alongside their use can really help people. It can really help people reduce their dependence or their use of any substance, including vaping. So I'm a big proponent of folks kind of talking to their doctors about their vaping, but also all the other mental health issues that might be going on at the same time.
Wonderful. Thank you so much for that insight. And I couldn't agree more. And how concerning as well, knowing that this is truly impacting depression symptoms, ADHD symptoms, many of which, users may be utilizing these products as a coping mechanism versus speaking with a clinician and getting a treatment plan in place to really be able to manage and live their best lives. So thank you so much for that. Really appreciate it. Dr. Rizzo, I'd like to toss it over to you. We know, we are inhaling, using these products, it is going into our lungs, and we know our lungs really feed our entire body. Everywhere the blood flows is affected by what we put into our lungs. Can you tell us a little bit about the lung health impact and just overall, physical impact of vaping on the human body?
Sure. Well, as you said, Jennifer, the lungs are so important. I mean, other than the skin, our lungs really are the first exposure to the rest of the world, whether it's wildfire smoke, climate change effects on particle matter, and really anything we inhale that has potentially irritating substance is going to cause inflammation in the airways. The trouble with e-cigarettes is they've been on the market in an explosive fashion only about 5-10 years now. And in the short run, we know that they do cause inflammation, bronchitis, wheezing, cough. We don't have long-term studies showing what is that going to mean with regard to developing chronic conditions, COPD, and potentially even lung cancer. We know that the e-juice that you mentioned contains chemicals and carcinogens very similar to what's in tobacco smoke. Maybe not at the same degree, but they are there. And we know that the long-term exposure to those kind of chemicals can lead to permanent damage in the lungs. So that's the concern we have for the fact that we don't know a lot about the long-term effects of e-cigarette inhalation.
Absolutely. And really looking at the entire spectrum life here, right? So we kind of opened with the dramatic increase in utilization across our youth, but, absolutely seeing it across the entire life spectrum here. I'd like to go ahead and start, with the adolescent piece and just ask you, Dr. Simon, why are youth so vulnerable? Is brain development fully, at its capacity and ability by, the time these kids are starting to vape at 12, 13? And if not, what impact is use of this products doing on the brain's development?
I think that's a great question, Jennifer, because it comes up all the time. A lot of adolescents and their parents actually define adolescence the way we do legally, that anyone under the age of 18 is an adolescent, anyone over is an adult. It turns out that doesn't actually line up with what we know about brain science and kind of the way the brain develops. So when we look at the way the brain develops, it actually continues till the age of 26, which surprises a lot of people, that is way kind of beyond what most people might consider thinking about legal definitions and what we talk about as a society. It's also helpful for people to know the order in which different parts of the brain kind of develop, and particularly what the last part of the brain to develop is. And that is our frontal lobes. They're the parts right here, which are the most important for executive functioning. And by executive functioning, I mean making good decisions, being organized, resisting impulses, kind of all the things that we associate with kind of being a functional person and a good citizen. And so if adolescents, which I'm defining kind of scientifically as anyone under the age of 26, have nicotine or another substance going into their system, that can really impact that development and leave them at risk for several things. So because that nicotine or substance is kind of coming at a vulnerable time into the system while the nerves are still developing, particularly those important parts of the brain, folks can be at higher risk of some of the mental illness issues we discussed, and also higher risk of potentially progressing from vaping to smoking cigarettes, which we see happening increasingly in adolescence, and also from vaping to other substance use issues. So we've seen that folks who can start with vaping or cigarette use at an early age can also progress to other more harmful substance use disorders. So those are just kind of some of the risks of using during this vulnerable time until the brain is done developing around 26.
Very concerning to hear that the decision making is not at its full capacity, right? As a mom of two boys, ages 6 and 9, it blows my mind of some of the decisions that are being made and how young we really are seeing e-cigarettes in the hands of our next generation. I know with our work at American Lung Association, we are offering alternative suspension programs for youth as young as 5th grade. My 9-year-old just started 4th grade today. So, it's crazy to even think how young these beautiful, brilliant minds are starting to use these chemicals before they're even fully developed. Dr. Rizzo, can you talk at all to some of the impacts? So you did say some of the short-term impacts of vaping on lung health and just overall body health. But, as teens are picking up these products and initiating them, what are they truly doing to their body physically so early in life?
Well, I think aside from certainly the mental effects that we've already heard about, they are potentially opening up their lungs to a more chronic condition, as I mentioned, whether it's asthma or allergy-related inflammation, COPD. And I think the biggest issue that both youth and young adults face is that they don't realize what the significance of what they're doing is. They have that misconception you talked about early on that this is a safer way to enjoy the benefits of nicotine or fruit-flavored e-juice. And we know it's not. These are very unregulated products that we know very little about what's in them to a specific degree because they're not controlled at this point by the FDA, although that's being advocated for and slowly being put into place. we just have no protection for individuals. And we also know that secondhand exposure to e-cigarettes can affect people around them. So a parent or a loved one who has a chronic lung condition, if you do use e-cigarettes around them, they may have the harmful effects of the small particles that get emitted from that device into their own lungs. So you don't really know what they're doing, these young people. And that's part of what the Lung Association needs to do to help raise awareness among the youth, but also more importantly, from parents of the young individuals, because there's still benefit from the parents intervening early on, having the discussion. We have a very specific talk called Vape Talk that the Lung Association has put out that can be obtained on our website. And I think if you have that discussion with these young people early on, it helps blunt some of the peer pressure they may experience when they get into middle school or high school. So I think I'll go back to what we said before. Acute effects we know about, we don't know the long-term effects, and that's the real concern that people have to realize they're putting themselves at significant risk of doing this.
Yes, and I love how you brought in the, the importance in, parents, really engaging in these conversations at home. I know through American Lung Association, we offer alternative suspension programs for schools, voluntary youth cessation programs, working with policy through our vape-free schools initiative. Lots that we are able to do with schools, but there needs to be messaging at home. The messaging that is received within our educational institutions needs to be reiterated by those parents at home. So what happens if those parents at home happen to be tobacco users themselves? What if they are smoking, vaping, or chewing tobacco? What kind of resources can we recommend to those parents to really help them break free from, a lifelong tobacco dependency?
Sure. Well, hopefully the physicians they're seeing, whether they're primary care or pulmonologists, are always asking their patients if they're smoking or using these devices, and then offering them options to quit. We know that counseling, along with one of the FDA-approved nicotine replacement products, is the best way to quit, along with having a support group around you, whether that support group is your family members at home, colleagues at work, but it's really more successful that way. We know that if you want to quit, it may take 10, 11, 12 times to really quit, but we do believe everybody can quit with the proper resources and the proper education. You mentioned some of the programs that are available. Freedom from Smoking is another online as well as in-person program the American Lung Association makes available to individuals. And I think if individuals know it's not just themselves that they're helping, but helping those around them by getting off these devices and being a better role model for their children. I think that's a very important message to send your children, is to not use these types of devices, whether it's cigarettes or e-cigarettes. And for those adults who think that they're going to use the e-cigarette in a way to get off regular cigarettes, it's not been shown to work. The FDA has not shown any product that in an e-cigarette category that is a successful smoking cessation device. Most individuals end up using both, to be honest. They don't switch, they don't quit, they end up using both products.
Thank you for that. Thank you for that. And also, I wanted to just ask one more thing, Dr. Zaman. When I think about working in the field of mental health conditions and just mental well-being in general, we do know that there is a disproportionate number of individuals who are diagnosed and currently working to manage a mental health condition that are in fact smokers or tobacco product users, a much higher percent. In your work day to day with these clients and their families, what are some tips that you really provide in helping them to get on the path of freedom from nicotine use and really helping to better improve and enhance their mental well-being?
I think that's a great question. People are often contending with multiple issues. Often it's depression or anxiety along with their nicotine use disorder or another mental health condition, maybe complex family issues, other stressors. And I think one of the important things is to just provide accurate information about the treatment options, and also to kind of hold out hope with people. And what I want people to know is part of the reason to be hopeful is that there are many options and people can benefit from different tools at different times. So what I like to do with folks is make sure that they have access to the entire menu of options. That includes behavioral treatments. So Dr. Rizzo mentioned a couple of great resources. I wanted to mention the American Psychiatric Association has a great vaping resource page. There are phone numbers to call. 1-800-QUIT-NOW is one we use a lot. There's also 1-800-LUNG-USA. I want to share those behavioral resources because we know that having the support, as was mentioned, having someone who is available as a counselor can really, really help folks who are dealing with trying to get away from nicotine and also maybe also another mental health condition. The other thing is, I want folks to know that there are multiple medication options. So there are some medical conditions out there in the world, in fact, probably more than not, for which we don't have any medications approved by the FDA. This is a condition using nicotine or being dependent on nicotine. That is something for which we have 3 really great FDA approved options. And I want folks to know those options. Dr. Rizzo mentioned nicotine replacement. I think that's a great place to start for a lot of folks. That can mean the patch, the gum, lozenge. These days, there are also nasal sprays and inhalers. So there are multiple forms of nicotine replacement. I also want folks to know that there are 2 other kind of tablet or pill form medications that can be helpful. So bupropion is a medication that helps with smoking cessation. It also happens to help with depression and anxiety. So I like people to know that if that's something they're struggling with, maybe we should consider that option. And then there's Chantix or varenicline, which is a twice-a-day medication, which significantly reduces urges and cravings to smoke. So I want people to have the entire menu, and I think that's really important. And then I think it's really important to be person-centered and say, look, having heard these options, what questions do you have? What works for you? What feels realistic for you to do? And then kind of bringing in the supports, bringing in the parents, bringing in the spouse, bringing in the best friend, whoever it is who can help support that initial plan, I think makes a really, really big difference in terms of success.
Excellent tips we can all keep in our back pocket, and love to hear that there are so many options. Never give up on trying because there's something else that you can try to finally succeed in freedom from tobacco use. So thank you so much for that. I have had an incredible time, meeting and discussing this topic with you, but I would really love an opportunity to tap into some questions that have been submitted by our audience today who are joining us in this Facebook discussion. The first one I would love to toss to you, Dr. Rizzo, really wondering, why are companies still allowed to market fruit flavors? We obviously know that it is not 50 to 60-year-olds that are, puffing on Fruit Loop flavored disposable vaping devices. So it's blatantly targeting our kids. Why are they still able to sell these products?
Yeah. Well, the biggest is a loophole. The law that was passed of getting rid of the flavors really only applied to what's called cartridge refillable products. The disposable single use did not fall into that category, and that's really what has flooded the market from overseas, particularly over the last couple of years. And it's really hard for the FDA to enforce the law at this point in time. There are millions of applications being submitted to the FDA for different products in this category of e-cigarettes that you mentioned at the very beginning. So it's part of it is hard enforcement. The other is still loopholes in the law that exist. And and I know that our advocacy department works daily in trying to help the FDA get through the rules and regulations and start enforcing this, because that's the only way we're going to be able to get the marketplace clear of them.
Thank you so much for that. And Dr. Zaman, another question came in that I would love to get your insight on. Can vaping or nicotine use cause other addictions? They'd like to know what kind of other substances are these gateways to.
It's a great question because I think sometimes people put vaping in a different category than other substances. And yet we know that vaping actually sets off the same reward pathway in the brain that many other substances can. And so that's something I like folks to know, that nicotine products are setting off a pathway that is similar to those that might be set off with by other substances. Now, what are those substances that people might progress to? Now, I'll say that's variable, but common things being common, many people go from vaping to smoking cigarettes. Many people might actually be vaping cannabis products, right? And so we haven't talked a lot about cannabis specifically, but often people might transition from vaping to kind of using an inhaled cannabis product or a different type of cannabis product. Some people, progress to smoking and drinking, which can go hand in hand for some people. So I would say progressing to using actual cigarettes, some type of cannabis product, and alcohol are probably the most common issues that we see. And also any number of the other substances we could think of together are more likely just because of that reward pathway that's common. That said, what I like to tell people is, that's helpful information to know if someone's thinking of cutting back or stopping, because it turns out that if someone is able to stop multiple substances at once, they're more successful than if they're trying to come off one at a time. Now, I want to support people in doing whatever works best for them, but say someone has progressed to something like, drinking and smoking simultaneously, I tell them that actually what we know is that folks, because both are setting off the same reward pathway, if you're able to work on both together, there are tools to help you do that and get away from those multiple substances at once. And I share that just to say that we shouldn't think just because someone has progressed to another substance that they can't stop or that they can't have effective tools to help them.
Yes, and thank you for bringing up the cannabis piece as well, because we do absolutely see that use on the rise, and it aligns with the question that had also come in from the audience and wondering if, when using cannabis, is it safer to smoke it traditionally or using an e-cigarette or e-pen for inhalation of these? Is there a safer way of doing it?
Well, I'll try to answer that. I think since these are unregulated most of the time, there's no true way to know what's safe or what's not. We really don't know what's in the e-juice if they add cannabis. We were concerned a year or two ago about what was called EVALI, the e-cigarette related acute lung injury, where there was the implication of vitamin E acetate contamination of cannabis in those devices. But really, we don't know what's in the e-juice. So a reputable marijuana or vape place might be something you would stick with, a medical marijuana if necessary, but otherwise we really have no control over quality control.
Thank you for that. And Dr. Rizzo, just continuing on that, I also hear a lot of questions come up from individuals who have the misconception that, e-cigarette use and vaping is safer than using traditional cigarettes. And in fact, have heard they're even, better. What would you say to individuals who are out there in the audience wondering, I'm currently smoking cigarettes. I'm thinking about, going to what I believe is a safer alternative. Are these truly safer? What are your thoughts?
Short answer is we don't know. We don't think so. The best step is to talk it over with your doctor, because they're the ones who are going to help you decide the best way for you to transition off of whatever device you're wanting to get off of, whatever substance you seem to be addicted to. Don't try to do it alone. Don't go to google.com or Google MD. Talk to your doctor.
I love that. One last question, and then I'll open it up for any last resources or any last words both of our experts would like to provide before we close today's discussion. Dr. Zaman, this one's for you. From our audience, does vaping impact anxiety? I've heard it makes it worse, but also heard it makes it better. Can you talk to us a little bit about that?
Absolutely. And we know that many people who vape report having anxiety disorders, and there are even some early studies showing that there might be some association between different anxiety disorders and people having an addiction to vaping or vaping regularly. And I will say, absolutely, there can be an association. We know that nicotine, when it first goes into the system and actually starts acting on our nervous system, does kind of what it's known to do, which is act on specific receptors kind of that are on our nerves. It is stimulating. So it a little bit like the way caffeine can cause a bit of kind of stimulation and some anxiety. Having nicotine initially going into the system can also lead to some increase in anxiety, right? And also, and this is, I think a lot of folks may have experienced this as well. When people are withdrawing from nicotine, they can also experience anxiety. So, withdrawal from nicotine, because nicotine really lasts in our system for a few hours at a time. So, between uses, people can go into nicotine withdrawal, and that can also be anxiety inducing. So, I would say that the studies in terms of kind of longer term impacts on anxiety disorders are ongoing right now in terms of vaping. That said, we know that nicotine, both in kind of the effect it has right when it's going in, and also when people are kind of going into withdrawal between uses, both of those situations or states can be associated with anxiety. So I like to tell folks to just be aware of that.
It's great to keep in mind and very helpful feedback for our audience. Thank you so much for that. And thank you to everyone joining us for this Facebook discussion, for submitting your questions and engaging in this fruitful discussion. It's so very important that we address the e-cigarette epidemic. It truly is a public health crisis and has significant impacts on mental health and well-being, as well as physical health and well-being. I'd like to thank you, Dr. Rizzo and the American Lung Association, for joining today. Also, Dr. Zaman and the American Psychiatric Association, thank you. It has been an amazing time together. So many more topics I feel we could come together and chat about in the future. Hopefully we can make that happen. Any last resources, last words, anything that you wanted to make sure we shared with the audience today before we concluded? Dr. Zaman, I'll start with you.
Sure. No additional resources. I think we've shared some of the common ones. I would encourage people to also look into mental health resources if that's relevant to them. So the National Alliance on Mental Illness, or NAMI, has some great resources. Of course, the American Psychiatric Association has great resources. So I guess my takeaway would be that we really need to be thinking about treating the whole person. So I hope folks talk to their doctors about certainly their vaping and also about any other mental health issues that might be of concern.
We are huge, champions when it comes to really look at whole person health. So thank you for bringing that up, and thank you for being a champion in that space as well. Dr. Rizzo, any resources or kind of last word you wanted to make sure that we got to share with the audience today?
Well, you did touch on the resources. Lung.org, along with NOT and VAPE, could all be handled very well. But I think the most important message is true factual knowledge of information empowers people to do the right thing. And that includes the physicians, the treating healthcare providers, knowing what to do with your patients, knowing how to approach your patients about these conditions, whether it's e-cigarettes, tobacco, whatever the substance is. But parents, children, and specifically healthcare provider know the facts about these devices and how you can help your patients.
Amazing. Great last words. Thank you to both of our experts for being here, helping us to stay on track with being our best when it comes to our mental health and well-being, as well as our physical health, and how to keep these tobacco products out of our homes, out of our communities, and definitely out of our bodies, right? My greatest thanks to you. And also on behalf of the American Lung Association, our greatest thanks to the American Psychiatric Association for today's collaborative Facebook discussion. It has been incredible, and we really look forward to being able to connect with the audience. If you want to reach out and contact us to keep the conversation going or to tap into the resources that have been presented today, we are on standby ready to hear from you. So all of our thanks, wishing everyone a great rest of your day.
Oh, great. Perfect. We're all clear on Facebook. That went lovely. That went very, very well. We had a lot of
Okay.
engagements, lots of questions. I'll so send a thank you note to everyone. And then tomorrow or later today, but probably tomorrow, we'll just download the video file and can send it to you and Nelly. And then we'll post it to our YouTube, and we're happy to post it to your two tomorrow or Friday.
Excellent. Wonderful.
Awesome. Thank you so much, Jennifer. This has been lovely working with you.
Yeah.
Your experts were, or Dr. Rizzo was just so on point. I think that went better than I expected. So thank you.
Oh, good.
Yeah, very good.
Yay. Good. If please know though, you know, you had some key players on the initial prep call. If they have any feedback on the event, please know I am always incredibly open and receptive and appreciative to any, you know, whether it be criticism or, you know, this could be done better, or we use these opportunities to improve every single time. So please don't hesitate to share any of that feedback with me, and I'll be sure to do that with the team.
Yeah, perfect. I will do. Thank you.
Okay, wonderful. Thank you. Thank you so much for today.
Yeah, thank you. Have a good weekend.
You too. All
Bye.
right, bye.